Wonderful. Hey, I'm Dr. Ruth Roberts, the original holistic pet health coach. And with me today is Dr. Kathleen Cooney. She is with an amazing group that I think really needs to be brought into the forefront, and that is the Canine Animal Euthanasia Training Academy. And I think this is so critical for many reasons. As a veterinarian, this is where most of our burnout comes from. It's hard, so hard, to have to talk to our clients about ending their pets' lives, even when it's an appropriate time. But having said all of that, so that you understand a little bit about where Dr. Cooney's coming from, she's been practicing advanced end of life care since 2006. She's the founder and the senior director of medical education for the Companion Animal and Euthanasia Training Academy. And Dr. Cooney is really well known for her work in companion animal euthanasia, is an author, researcher, and international speaker on the subject. She's a strong advocate for best practices in end of life care and loves things old and gray. So you can learn more about Dr. Cooney's accomplishments at caeinternational.com, and I'll drop you that link in there in just a moment. But Dr. Cooney, thank you so much for taking time and spending that with us today. I'm really grateful to have you here because this is a topic that so many people know that they're going to have to approach at some point in their pets' lives, but but it's often very difficult. So welcome.
Thank you. Thank you for having me here. And I took time, of course, in prep for our session today to learn more about your work, Ruth, and everything that you're doing with this company and the coaching that you do. So thank you as well. It's very impressive.
Well, thank you. It's and that's it. The more folks out there that can help pet parents, the better. So that's what we're all about. So this is we were chatting earlier, that was towards the end of my brick and mortar career. This was one of the most difficult things for me to continue doing as a veterinarian. But yet your focus in your career now and for quite some time, really 20 years, has been end of life care for pets. So what drew you to that topic or to that focus?
Yeah, thank you. First of all, I've always been someone who loves the human animal bond and stories, the connection that people have with their pets. And while it might not seem intuitive for someone to gravitate towards euthanasia work to find that, to find the beauty in that, that's really what happened for me. So I graduated from veterinary school in 2004 and went into a thriving general practice with about 7 doctors and many technicians, and touched all parts of veterinary medicine in that practice, from vaccination appointments to surgeries and, of course, to euthanasia. And it was after a period of time where it felt like I was actually getting scheduled maybe more euthanasias than what my colleagues were getting scheduled for. And I thought that, well, that was kind of interesting. And then the question came to me, well, is this normal for, a new grad or a veterinarian that's only been out for a year or two to see this many appointments? And so I started asking questions, and it kind of seemed like the staff were scheduling me euthanasias because I was just as balanced coming out of them as when I was going in, right? So we might think that being in the space, witnessing euthanasia, witnessing the sadness and the hardship would be overwhelming for all people. But I seem to be approaching it a bit differently. And it feels like my team was picking up on that. And that could just be in my head. But I appreciated that if I was doing the euthanasia appointments, that the clients seemed pleased. And of course, I was very content with the way that I was performing the procedure. But what really changed things for me was when a pet owner asked me, or one of my clients at the time asked me to help with a home euthanasia. And I wasn't quite sure if we could do that at the practice I was working at. So I asked around and figured out a way to make that happen. And when I saw a home euthanasia facilitated, It changed everything. It absolutely changed everything. To think that here we could release this pet from their body in a space of familiarity and comfort where loved ones could gather around, where other family pets could be there. It felt like a more holistic approach to me, right? All of the elements that I'm trying to bring into the hospital were there at the home. So that is really what, really sparked and kicked off my movement into euthanasia as a chosen career. And I ended up starting a mobile euthanasia practice when I moved back to Colorado. Long story, but moved back to Colorado and started a mobile euthanasia service. And also through that is where I discovered animal hospice. So there was a point where my families would say to me during a typical euthanasia appointment, and keep in mind that if I'm only doing euthanasia, I'm not providing care for these patients from what we say womb to tomb, cradle to grave, birth to earth. I have a brand new relationship. So I'm getting a lot of the story there in the moment. And the families were often saying to me after euthanasia was complete, thank goodness that's over, right? This has been so hard to watch my pet decline in health, decline with this cancer or congestive heart failure, or just age-related changes. And and then listening to them and the relief, that it was over was very jarring for me. I was very surprised. I'm like, death journey doesn't have to be difficult. It can be very beautiful, especially when we lean into it in the right way. So that's where I was finding this disconnect between, terminal diagnosis and that death is coming to euthanasia. There's just a lot of gap and lack of support there. So that's what brought me into hospice and palliative care. So the journey it's really been an absolute blessing. I'm so lucky, really, truly lucky that early on in my general practice work, I found a passion for end of life and then could sculpt my career accordingly to help well over 10,000 families at this point here in Colorado, which is where I'm coming to you from today.
Wow.
It's been great. It's been so blessed.
That's amazing. So, and let's just make a couple of distinctions because I think even on the human side, where palliative care has been going on for 30 years, most people don't understand what that is versus hospice. And so, if you could help us define that a little bit, that would be amazing.
Yeah, that's important to do. So when we use the term hospice, there is an understanding that the natural end of life is approaching, that death is coming. In human hospice, we usually attach that to 6 months or less. In animal hospice, we actually don't have a set time frame for it. And I think part of the reason for that is, first of all, lack of financial funding for hospice in pet care compared to human care, but also because we always have the option for euthanasia. So if things are starting to get too difficult, that we cannot manage the pet's physical discomfort, emotional stress, then we can always step in and help with euthanasia. And that inherently shortens maybe a typical time frame for hospice. But in general, we say that a pet is likely to reach the natural end of their life within the next couple of months. Okay, so hospice care is really a philosophy of care where we're looking at the physical needs of the pet patient, we're looking at their emotional needs, and then we're also caring for the pet owner, their emotional needs, providing a lot of education, and just making sure that this journey is as stable as possible until death comes in whatever form it's going to be, whether or not that's through hospice supported natural death or through euthanasia. Now, it is possible that a pet will naturally pick their time and pass at any point without hospice care. But when we are enrolling a patient in hospice, there's a lot more medical support and, again, emotional support and education and communication that goes with that. Within animal hospice, as I've been mentioning, this physical support, that's through palliative medicine. Okay, so medicine that is aimed at providing comfort for the pet rather than cure. So let's just take cancer as an example. The family has decided that they're not going to pursue chemotherapy and other curative kind of treatments or trajectories for that particular type of cancer. And they say we want to just keep our pet comfortable and through whatever that death experience looks like. So that's what palliative medicine is. Think about pain management, nausea or vomiting control, might be hydration for a period of time, like giving fluids. It might be a whole variety of things that we can provide, both kind of on the traditional side and the more holistic side, which I certainly gravitate towards with much of my work. So it's about palliating whatever the pet is feeling so they forget about the disease, so they can live life as normally as possible. But it's also important to clarify that palliative medicine or palliative care can happen at any point throughout a pet's life when a disease has been diagnosed. Diabetes is a great example. So when we're providing insulin and diet changes and things like that, really what we're doing is trying to palliate the disease to try to keep it a bit under control, but we're not curing it. So you can have palliative medicine throughout a pet's life for a variety of diseases, but animal hospice is unique that you have to have palliative care during hospice. Okay, so if you're saying that you're hospicing a pet, you're providing comfort care for them until they pass.
Thank you, because I think those distinctions are really important. Um, we have the ability to do so many diagnostics, so many tests, et cetera, and at some point, those tests create more stress, create more dis-ease in the pet and the pet parent than they're sometimes worth. And so I think that's where palliative care can be applied for chronic disease versus the ongoing testing and so on and so forth. When we're not going to get to a cure, we're going to be managing the disease at best. So
Mhm.
thanks for that, because it's tough sometimes and it gets frustrating for a lot of pet parents. So we've got a situation, a terminal disease, end stage kidney disease, cancer, um, arthritis. That's just the pain control has become extremely difficult. And what things could a pet parent start to use to know that, hey, maybe it's time to start thinking about whether it's fair for my pet to keep going. And I'm going to drop some links that you so kindly provided um, about how to go through that decision process. So let's talk a little bit about how a pet parent might start to think about that.
Yeah. And I appreciate that you said it's time to do something, time to think about something, because we might default into seeing a pet decline and say it's time for euthanasia. But it might be too early for that, right? With some good palliative medicine that we can improve quality of life, sometimes a little bit, sometimes really significantly to provide a lot more time. And so it's about getting information, whether or not that is through diagnostics like blood work or ultrasound. And myself, I have an elderly black lab who we've just made the decision that we're going to do an ultrasound on her belly because it's just getting a little big, a little pendulous, right? Just a little bit bigger than what I'd expect for her. Doing great otherwise, but it's like I want to know what's going on in there. And I think a lot of pet owners would feel the same. So it's about learning what we can for what the pet is actually going through with their body, and then partnering with a veterinary professional who can have long and rich conversations about what the natural end of life process looks like, what we can do with good palliative medicine, so that we can set a bit of a plan going forward. And it might be a very small plan, such as let's go ahead and layer on this medication for a month and see if that makes an improvement. Or let's do some household modifications that are relatively easy and straightforward that can radically improve a pet's quality of life because now they can navigate their home more safely and easier. So a lot of end of life conversations are about education, right? Knowing what's coming. So pet owners right now, even before they talk to veterinary professionals, can start to do that, right? To be your own best advocate for what's important to you and for your pet. So to learn and search, and there's talk to your coaches. There's a lot of good information that's out there. But when it really comes to wanting to know what the pet is experiencing, that's where veterinary professionals are going to do their physical exams and do some diagnostics. What the veterinary team will also do, if they believe that the pet is starting to decline in that natural progression towards the end of their life, hopefully they're going to start to increase a communication schedule. They're going to talk more about the different modalities that are available, right? It doesn't always have to be heavy pharmaceuticals. There can be other things we can use, some more physical therapies to provide that comfort, but empower pet owners to be informed and to make decisions logically with the least amount of emotion. Now, this time is heavy with emotion no matter what. In fact, as soon as we know that our pet is reaching the end of their life, we can start into anticipatory grief. Right? Anticipatory grief is different than actual grief from the loss of the pet, but it can be very crippling. So that's where veterinary teams and pet owners really need to become a team to provide the care for the pet. So in other words, take away lots of learning, lots of asking questions, lots of monitoring and watching. How is today different than yesterday? How is today different than 3 weeks ago or 3 months ago? And maybe even moving in with some quality of life scales that are out there to give us a bit more of a read on what the pet is actually going through.
Right. And one of the things that you so kindly provided was a link to the quality of life scale that you've been developing, which I've dropped in here. But this is a really good way to put a number on things that's a little more objective instead of being in that state of panic and that state of fear that the pet is not, the pet's not doing well, but how bad actually is it?
Yeah.
And realizing this is going to shift from day to day. And so using that like, oh wow, okay, this quality of life score is really just trending down. And it is. It's difficult when you're caring for a pet that's got some significant health challenges to kind of know where things are without tracking it. So I think that's just a critical tool.
I love that, Ruth, because what you're bringing up is the fluidity and the changes that happen during the end of life. So if audience here today listening to me takes away nothing else, it is to be patient and to be accepting of the change that comes with the end of life in whatever form that is, because we can only control so much, right? As much education as we have and tools at the ready, death is its own event, and the pet will go through it in their own time, in their own way. Ours is really to shepherd and to chaperone that and make it as comfortable as we can, knowing that if at any point we need to step in and help with euthanasia, we can. And also want to just point out, with that lovely quality of life scale you just looked at, that is provided by Lap of Love, which is a home hospice and in-home euthanasia service around the United States. And Lap of Love is my parent company to the Companion Animal Euthanasia Training Academy. So I'm like their educational arm, if you will, teaching veterinary professionals and those who are a part of the veterinary team on best practices with euthanasia. So I'm grateful to Lap of Love to have resources like that available. And then, of course, CATA, we have some of our own too.
That's amazing.
Mhm.
And Sarah's asking a question about, what can you recommend for older dogs and that you've seen to prolong their lives? And Kathleen, I know you'll have an answer, but Sarah, ultimately, it's you and your team looking at what can we do to make your dog's life better, and really understanding what individual challenges he or she is facing. That's part of what the health coaches can help you do if you're having difficulty having that conversation with your veterinarian. And so many of our colleagues are just overwhelmed and incredibly busy. It's difficult for them to have those types of conversations.
Yeah, good advice. Lean on those coaches. And I probably would take the answer to this question all the way through to a few days out from natural death, just because this isn't something we typically talk about. We tend to talk earlier on in that trajectory and the early parts of decline. But when we're getting really close to death itself, things change. The needs of the pet changes, right? So an animal, for example, that may have been eating, who is no longer eating, they might have changed because their body says, I don't need this anymore. Actually, bringing in food can be more of a detriment and slow down the dying process than the good that it brings. So at some point, there may be a cessation or stop to the feeding. But what we also want to do in a time like that is to make sure that we're analyzing, is the pet stopping eating because of nausea or because of pain or something else? That's where the veterinary team will provide particular medications or therapies as needed to ensure that those symptoms are palliated. And if they're properly palliated and the pet still doesn't want to eat, then that is actually something that we simply need to respect, right? Because doing, force feeding, doing feeding tubes, things like that could be more of a detriment. And it's not about allowing a pet to starve or, wither away like that. That's not the goal of hospice. In fact, if you think about what the main mission of hospice is, it's neither to postpone or hasten death. It is about the journey leading up to it to make life worth living as long as life is there. So again, through palliation and through emotional support, anxiety mitigation, whatever it is that the dying process is bringing. The other thing with food is water. So water is for the living. Water is not for the dying. So as a pet patient gets very close to the end, usually within a week of natural death, it's typical that they're going to stop drinking, right? Even those kidney failure cats that you mentioned before, Dr. Roberts, there will come a time when they don't want to drink anymore, even though that has been their MO for months, years, sometimes just drink, 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 drink. They get to the point where it's actually going to do more harm than good, and instinct takes over and they simply don't do it anymore. But we again have to look for, are they painful? And that's why they're not getting up and going to the water dish. Are they too nauseous to take it in? So if we're providing it and making sure that they're comfortable and they're not taking it in, so be it. So that's where seasoned and trained coaches and veterinary professionals that understand dying can be really, really helpful here, because it is something we're not taught about in veterinary school. Veterinary technician colleges don't teach about it. So our nurses out there don't know a lot about natural dying. So the more that we know, the more that we can make educated decisions about what's best for our patient. And ultimately, that's good for their welfare.
Amen to that, and that's the thing. I mean, if you're in a situation where you can work with the folks at Lap of Love or your veterinary team can really support you, fantastic. If you're not, that's where a health coach can help you prepare questions to ask the veterinary team to get support for your pet. And I think that I need to make that distinction as well, because sometimes it's hard to know. If you're in the middle of things, it's so, we're spinning around with like chickens with our heads cut off practically. And to have somebody outside you that can help you ground, take a breath, and then figure out, okay, wait, did we make sure that, as you just suggested, is this cat not eating because it's nauseous? Or is it because really it is at the end of life, and it's doing something that its body knows how to do to take care of things?
Yeah.
So I think that's a critical distinction. Um, I think one of the things is, what do clients expect during a euthanasia, and how do we keep pets feeling safe and supported through this process too? Because it's a very intense time. So
Mm. It is. It is a very intense time. And what I've learned through all of my years of doing end of life work and the interactions with clients that I see and talking to veterinary professionals and others that are there for the procedure, that it's simply meant to be hard. And I think it would be strange if it wasn't, right? That maybe we're not applying enough kind of energy or attention to this beloved pet and this animal and whatever its backstory is, because otherwise we would be missing out. It's important that we apply the love and the attention to this procedure that it deserves. And we did research a couple of years ago to look at how pet owners define a good death, knowing that at the heart of it, it's going to be a good death for their pet. So, what is it that they are looking for? And then, can we craft a really good definition of companion animal euthanasia from that? So, about 2,000 pet owners weighed in and shared with us common themes, and then we built up that definition. And we also surveyed veterinary professionals to see if it lined up. And for the most part, it did. And that was really positive to see. So, what we can say right now for pet owners that are looking for a good euthanasia, and euthanasia, by the way, means good death. So, it's kind of like I just said, a good death. But what we're looking for is pet owners want more help with pre planning to know what is possible for this experience, right? Who can be there? Where can they be? And what special touches can they have, such as favorite foods, to musics, to reading? All of those things empower a pet owner to develop an experience that's going to be very meaningful for them, and what they also believe is going to be meaningful for the last moments of their pet's life. How would their pet build a euthanasia appointment? What would they want? When you can put a pet owner in the driver's seat of that, then you've got a much smoother event or appointment for this animal itself, right? Because the pet owners know them best. The other things that pet owners are looking for is a pain-free experience. So minimal to no pain during any sort of injection or handling. They want something much less clinical and much more comforting. So we veterinary professionals who are performing the procedure then need to spend a lot of time and reflection on what's going to be best for this pet and this pet and this pet. We try to have a pretty set protocol, but at the end of the day, it needs to be what's best for each individual animal, with this idea or this goal of reducing pain and anxiety as much as we can. Another thing pet owners are looking for are their pets sleeping in their final moments, right? So now these days, we are providing what's called pre-euthanasia sedation or anesthesia, which is full-on unconsciousness before the pet is given the euthanasia solution itself. So it's more of a two-step process these days. So your pet might be given an injection underneath the skin, similar to a vaccination, to relax them into deep sleep. After 5 to 10 minutes, then the veterinary team will prepare for the actual euthanasia technique. Okay, so it's kind of a two-step. And that way, those families who were really hoping that their pet would pass peacefully in their sleep, that's as close as we can manifest that. And when I did some, I'll say, kind of loose research with my clients years ago, and I asked them, how do you want your pet to die? 95% of them said, I'd prefer my pet to pass peacefully on their own, so I don't have to make that choice, but I'm still open to euthanasia. right? So they would like their pet to pass on their own. The other 5%, in case you're curious, was broken down into a few that only wanted hospice supported natural death, where euthanasia was simply not an option. And then a couple percentage of those that wanted a planned euthanasia because they didn't want a natural death. They wanted to be there to say goodbye. They wanted to have more control over that, which really is the greatest control you can have over the death event is through something scheduled like euthanasia. Otherwise, there is a lot of flexibility. So I've said 3 things so far: pre-planning and reduced pain and anxiety to their pet sleeping. The fourth one is the ability to be there all the way through the appointment and to never be separated from their pet. So if you remember something else important today, to take with you into the future when you are present for euthanasias, is if your veterinary team kind of insists on removing the pet from your presence, is that it's okay to advocate for the pet to stay with you, whether you go back with them to the treatment area or the veterinary team comes to the euthanasia space. Home euthanasia providers always do everything in front of the family with the patient right there. So we know that that is very doable, and that home euthanasia happens all around the world by the thousands every day. So it is very doable. So that was important, that they didn't want to be separated from their pet. And I'll give you the last one real quick, because you're probably guessing what it might be anyway, is the option for home euthanasia. Right, that rose up to the top as well. Those families saying that their best experiences were home. And typically it's because there's more pre-planning that's involved with it, that, those home euthanasia providers are, giving the sedation, the anesthesia, providing the sleep, and having a little bit, well, usually considerably less clinical feel to the appointment. So those veterinary teams that are working in the hospital are doing everything they can to keep it very gentle and smooth and meaningful. But I also think pet owners need to advocate for what is important to them.
Amen. And that's, that is part of what sort of going through that pre-planning and actually having the resources like the training that you've put together is really, really critical. So we'll have a little more information on this in a moment. But again, Dr. Cooney is from the Companion Animal Euthanasia Training Academy, and this is geared more towards professionals. But many pet parents have gone through this program as well, because it helps them not only prepare for their own pet's potential death and moving forward, but also to be supportive to other friends and family as well. So I
Yeah.
think that is just the more information that you can gather, the more comfortable the entire process can be. So I
Mhm.
think when we have that luxury of planning, it really makes a huge difference. Um, and one of the things you are still doing in practice is at-home euthanasia. So could you kind of walk us through how that might go for one of your clients? And I
Yeah.
know that's a broad descriptor, but yeah.
Yeah, it's important to know what home euthanasia looks like, but a little clarifier is that I did start a home euthanasia service back in 2006. I sold it about 10 years later. So while I don't perform home euthanasia these days, I have written books about it and grew up this wonderful practice and teach on it all the time. What I ended up doing was I started on my little farm here in Colorado, a home euthanasia. I just called it a home euthanasia center. It's a euthanasia comfort center where families come to me for euthanasia. So they essentially come to my home instead of me going to them. But that said, a center like mine are very few and far between. It is usually hospital for euthanasia, or home, or the animal shelters. And animal shelters, for the most part, have limited resources and kind of skill sets for their team to allow pet parents to be there. So often there is that disconnect. So it's often hospital or home. For home euthanasia, Really, how to get started with that is if you're even thinking that your pet might be nearing the end of its life, that you're feeling like you need to start planning, is to call the home euthanasia providers and hospice for that matter, if you want hospice support, because sometimes those companies go hand in hand. It's very rarely is there a animal hospice service that doesn't offer home euthanasia, but there are home euthanasia services that don't offer hospice. So look and research through their websites to see what they provide. But start calling ahead of time to find out if you like them, if you like the vibe and what they're telling you, that it feels like a good fit. Find out what their availability is and their cost. Also talk about aftercare, right? What's going to happen with the deceased pet afterwards, such as, is the mobile veterinary team going to take them to the crematory, or would that be on the client or the pet owner to make those arrangements? So those are things that can be all detailed out ahead of time. And then when home euthanasia actually occurs, it will either be one or two people typically that will arrive at the home. So it'll either be the veterinarian or the veterinarian with a technician that will arrive at the home. And that said, there are some states in the US where it will be the veterinary technician who is performing the euthanasia. And as long as they've got the proper training and it's allowed, there's some merit to that. So just be aware, but typically it's the veterinarian or the veterinarian with a technician or a helper. They'll arrive at the home and they'll enter in and they'll gather wherever you want to be with your pet. They will likely take just a few moments to talk through some of the details that were shared ahead of time, such as the aftercare arrangements. And, do you want that veterinary team to notify anyone on your behalf, such as regular vet hospitals or specialty services that you've been working with? Is there anyone that they can notify for you? Is pretty typical. And then if payment hasn't been done already, they might do that at the time. But then things will shift into the actual, procedure itself. And the veterinary team will talk you through what it's going to look like to give those pre-medicines for the sedation time. And then you'll wait for your pet to welcome those drugs and start to get sleepy. And then the veterinary team will talk you through what euthanasia technique they're going to do so that you've got some information about that. And then usually they offer some privacy before and after the procedure so that you can really have, again, an experience that is at your pace. Afterwards, it's very common for the veterinary team to make memorialization items like paw prints or collections of fur. And then if they are taking your pet for aftercare, then they will, depending on the size of your pet, bring in a little basket or maybe a stretcher with blankets to tuck your pet on, and then make that journey to the aftercare facility on your behalf. Home euthanasias are typically about an hour long. That's been my experience. Some of them will be a little shorter and some of them will be longer. So if you're trying to plan it out with family and other things that might be going on in your day, anticipate about an hour. And the other thing worth mentioning is that home euthanasia providers that are out there a lot doing this work, they might be moving from kind of appointment to appointment through the course of the day, and they might give you an arrival window. So rather than saying, I will see you at exactly 10 a.m., they might say, we'll arrive sometime between 9:30 and 10:30 in the morning. And we might text when we're a few minutes out so that, so the family has a better idea of that arrival time. But it's all about what you want to make it and making sure that your pet is as comfortable as they can be in that euthanasia experience. That's really at the heart of home euthanasia.
That's amazing. And let's see, here it is. Karin had a really great question for if you've got multiple pets or a bonded pair. What's your advice on allowing other pets to be present or during or just after the euthanasia?
I love having other pets there. That's my simple answer is if they want to be there, I want them to be there. And the only time I might avoid that is if it's really young puppy who's running all over things and I'll say a lack of respect on their part because they don't know any better. Me as a veterinarian, I need to perform a medical procedure, and there are some inherent risks there. So we want to make sure that this is carried out successfully. So that can be a little bit difficult, but there's always workarounds, right? Having a rambunctious puppy and a carrier that's right there so they can still be present and watch what's going on, to having them with a harness and leash, you get the idea. But I've had some of my most memorable euthanasias with other pets in the room, such as they seem to understand what's happening. I've had dogs jump around the body of a deceased housemate. I've had them come and stand over the top and howl. I've also seen where pets weren't allowed to be in the room. We've removed the body from the room, and the other pets, when they were allowed to go in, sat around the exact space where euthanasia happened and almost like held vigil. It's amazing what can be going through the minds and emotions of these animals. So if they can be there, I like it. That's certainly a benefit of home euthanasia. But even here at my comfort center, families bring their other companions all the time. So we have to make sure that things are very calm and very controlled, because we don't want to have a negative kind of experience for those other pets who are there, because then we might have more difficulty, down the line.
Right on. That makes total sense. And Kelly, sounds like you're going through some things. So this recording will be up on Facebook and YouTube forever. But yeah, Dr. Kathleen has some amazing ways to help us reframe and reset in our minds, ways to think about hospice care and end of life care. So that'll definitely be there for you. One other thing, when we start thinking about, okay, wow, things are, just going, this dog's getting old. Like Hayo, I know she's somewhere between 12 and 15. And she's got her own set of issues. Thankfully, things are stable and smooth right now. But what are some more holistic approaches we could think about adding to support our pets as they approach the end of their lives?
Yeah, so we want to use the pharmaceutical agents when we need them. Okay, when we're really worried about pain, seizures, some of the other conditions that we want to leverage the best of our medicine, we do that. But other things that we can start layering on, certainly everything that comes out of Chinese veterinary medicine, from herbs to massage like Tui Na to acupuncture, a lot of the physical modalities out there we definitely want to be applying. Anything that's going to reduce inflammation is also very powerful, because dying animals have lots of inflammation going on in their body. I happen to be a big fan of the PEMFs, which is the pulse electromagnetic field kind of therapy, and very powerful what do they call it? A non-pharmaceutical anti-inflammatory device, NPEDs. And I love those, just to try to reduce pain in joints, to inflammation in the abdomen, to the bladder. So that would be something to reach for. So in other words, the physical therapies. But we mentioned Chinese herbs before. I also think that there's a place for flower essences. I think there's a place for just homeopathy and music. Music is actually one of my favorite things for the hospice journey itself. I mean, certainly euthanasia music can calm and to soothe, but some of my clients have told me over the years that harp music played every day regularly, whether or not it's a little bit in the morning, in the afternoon, in the evening, or just all the time, that harp music we know to scientifically soothe and calm the listener, or even just through the sound waves that move through the skin. So I had a family many years ago with Great Danes with cancer. And every time she called, I knew that she had another Great Dane with cancer, and we were going to be walking this hospice journey until the time would be right for euthanasia. And I said to her after the first one, "You still got your harp CD?" She said, "I do, and I'm going to play it all the time," because she said to me that was very important because not only did it calm her pet, but it calmed her and her family. So that's really the holistic approach that I want to make sure to touch on today too, is not only the therapies that we're applying to our pet patient, but to the caregivers. Because if they're not balanced, they're getting worried, they're getting anxious, and they can start to spiral. So we have to focus in on what's at the end of that leash and talk to them about the way that they're feeling, making sure that we understand, what's coming up with everything from travel to maybe some financial barriers that might be there that's starting to cause them pressure. So it's about being curious, asking those questions so that we can figure out the best way to support both ends of that leash. I want to share with you something real quick though before I forget.
Yes.
We've got a colleague out there named Dr. Tammy Shear, who does a lot of really good work in North Carolina. And like she was even experimenting with how can we use more holistic approaches even during euthanasia itself. So she did a little bit of research about I guess you could say pressure or puncture point. I think it's liver 3 in the back paw that would possibly stimulating that point during euthanasia help to reduce down some of the active signs of dying, right? So I think it's about us being curious to what can we apply during the path towards death as well as the death itself that could lead to a smoother experience. So there's a lot that's out there, but I would say just lean in to everything that's available. And if it's going to reduce symptoms, it's worthwhile using.
That's amazing. Beth is asking, what do you think about working with animal communicators before, during, and after end of life experience?
I'm all for it. I'm all for it, especially if they're giving good advice. So I have worked with animal communicators that have what I'll call some heavy biases towards euthanasia. And I've worked with some that are very open to whatever it is that the pet is telling them. And so I've had kind of good and more challenging experiences. Having had animal communicators present during euthanasia, it certainly feels good to me when I hear from them that the pet has conveyed thank you and gratitude and all is well. I've had some communicators say that the spirit's right here, kind of hovering and watching, and I've had others say that the spirit is already gone and they're on their way to other adventures. So I don't know for sure, but if it brings peace to the client and I can still facilitate a peaceful passing for my patient, I'm all for it.
Amazing. Dr. Cooney, thank you so much for being with us today. One of the very kind offers you have made as well is, and for the coaches, but this is a discount, a $30 discount on your course at the Companion Animal Euthanasia Training Academy. And this is a way for you all to gain knowledge about how to support your clients better and help educate them about the process. Because if you live in an area where you have access to lap of love or practices that are educated and skilled in supporting in hospice and euthanasia, that's amazing, but many folks don't. So it's important to educate yourself well in advance of needing this information. So this is a great way to do it. So again, thank you so much for spending this time with us. It is an incredibly important topic. It's one that most of us don't want to think about until we have to, but I think it's critically important to do this in a state of calm instead of in a state of panic and like, oh my gosh, I need to take care of this right now. So preparation is key to making this transition easy for everyone, for the pet, for the family, for the other pets in the household. So thank you for spending time with us today.
You're welcome. Thank you for the invitation. And if I can take one more moment to share a
Please.
couple other of resources. There is the International Association for Animal Hospice and Palliative Care. That is a great resources for all that want to learn about end of life. It is designed, especially with some of their webinars and their certification program, for veterinary professionals, but there's a lot of information there for pet parents. There's also a group called the Animal Hospice Group. So, very straightforward title, Animal Hospice Group, that I think your coaches would like to learn more about. And then just a reminder that the Companion Animal Euthanasia Training Academy, whose website is CATA, which is just our acronym, catainternational.com, we have a lot of blogs. I've been writing blogs every 2 weeks for about 6 years. And if you want to dive in there for a variety of topics related to euthanasia, that's a good place to go. They're easy reads, about 4 minutes long, and we'll also direct you to some other links as well.
Wonderful. Thank you so much.
Thank you.
Thanks again for spending today with us. This information has been so helpful, and I think this will be a great resource for coaches and pet parents alike, because it's a great way to sit down and grasp all of the information you need at one time and process it, and then be able to formulate the questions you need to ask to support your pets. And so thank you so much for that. And for all of you out there, we will see you soon. Have a great week. Hug your babies and give them a kiss for us.